Hello everyone, my name is Heather Speeney. Welcome to the first of 4 presentations on Pennsylvania's IDD Autism Waiver services. This first video will focus on a broad overview of the system. We hope you find this informative. What is Waiver? The Center for Medicaid and Medicare Services, known as CMS, provides the program that waives certain rules and/or criteria to use CMS funds for community-based services instead of institutions, hospitals, or nursing homes. A waiver year runs from July 1st to June 30th each year, and the funds that are unused do not roll over. Each fiscal year begins with services within the budgeted amount. Waiver is not taken away if you do not use the full amount each year. The waiver recipient can choose to end waiver if they want, though this is not recommended unless you do not require services anymore. Waiver recipients are asked to use services at least monthly. Do I qualify for IDD Autism Waiver? If you or someone you care for meets these requirements on the screen, you are eligible for services through waiver. You could call your county intellectual disability office. Some counties combine intellectual disabilities and behavior health offices. Let them know that you would like an intake for the IDD Autism Waiver. From there, you will be directed through intake and then will be put on a waiting list. It is best to get on this waiting list as soon as possible, as some counties can have a waiting list of a couple years. Once you are on this list, though, sometimes there are other funds that can be offered in the meantime, like county funds. There are currently 3 types of waivers available. Let's look at each of them individually. The Person Family Directed Supports, PFDS Waiver. This waiver is typically the first waiver offered, as it is the lowest budget and can cover most basic needs when people come into waiver. When waiver is given, your needs level is considered. The needs level is guided by the Supports Intensity Scale, known as the SIS, for information collected by the SIS assessor. The SIS is completed every 5 years unless there is a significant life change. The needs level is looked at with some other factors, and a decision is made as to which waiver would be able to fund your current needs. Some individuals may start out at a higher waiver due to increased needs when they receive their waiver. If you have a PFDS budget, you cannot receive services that cost over $33,000 in a fiscal year. The exception to that is if you receive advanced supported employment or supported employment services. You may be eligible to get up to an extra $15,000 towards these employment services. If your budget is stretched between other services and supported employment, please talk with your supports coordinator to see if you are eligible for extra employment funds. The extra $15,000 will not apply if there are your only services. In 2018, the Community Living Waiver was approved as another option for waiver funding. This waiver was initially started to fund those who needed over the PFDS capped budget, but maybe not by much. Some of those who initially benefited from this waiver were those who had community participation supports with transportation and in-home and community rehabilitation and or companion services. Many times, individuals would go to their community participation supports programs during the day, but need services in the evening and or on the weekends. The PFDS waiver truly limited the options of evening and weekend help. There are many other combinations of services utilized by this waiver. The Consolidated Waiver is known in the system as the unlimited waiver, where everything is based on need. Just because you have Consolidated Waiver does not mean that you can add any service that you think might be helpful. There still needs to show a need for the service and why it would be beneficial. You also might be asked to try other services that may be cheaper first. Typically, this waiver is used to fund residential services. Another scenario is if someone had a combination of services or expensive services. If you have community participation supports with transportation, in-home and community habilitation, and then maybe a behavior service or a nursing service, it probably is not going to be covered by our CLW waiver. Switching to a next waiver can be pretty difficult and is discussed in another presentation. Once you receive waiver, you will begin to hear a lot of terms and acronyms being used. There's a lot of service names being used in this presentation, and there is another presentation to discuss those services. For the sake of this presentation, some of the terms currently used in our system that are very important to know are on the list here. You can also visit our website for a list of abbreviations. First, we have the prioritization of urgency of need for services. This is referred to as the PUNS. This is a tool used by your supports coordinator, your SC, to discuss needs of the participant. This plays a vital role in how ODP, our Office of Developmental Programs, manages the waiting list for waivers. There are different levels to discuss if the participant's needs are met or not. As our lives change, so do our needs. This list helps keep perspective on where you are with your needs. If things are going well, you could foresee needing more assistance in the next couple years, or if there's an emergency or quick change, where more services are needed quickly. Healthcare Quality Unit is called our HICU. This unit serves as a support for health information and training for the intellectual disability population and their supports. HICUs offer online courses that are easily accessible to everyone across the state. Information about the HICU can be found on the ODP website, myodp.org, or by using the link provided to view the courses offered online by all the HICUs. They also will train participants and team members face-to-face when needed. Next is our IP, or Individual Plan, formerly referred to as the ISP, Individual Support Plan. This is the document that puts the participants' current situations and historical data in the areas of physical health, mental health, developmental health, sensory needs, goals for each service authorized, etc., in one document. The outcomes are the goals agreed upon by the team for the service providers to work on with the participant. These can be altered or changed as progress is made or needs may change. The last one is our service utilization. This is how the services are authorized to be used. For example, if your IP says 3 times a week for 10 weeks, or 30 hours per month for 12 months, this should be followed as closely as possible, as you cannot exceed these timeframes or alter them without a meeting with your SC. The family legal guardian's role when they are staff. This rule notes that one family member cannot provide more than 40 hours in a week of service. If there are two or more family members providing services for the participant, then one family member can still not go over 40 hours, and the other family members can work the rest of the hours, not to exceed 60 a week combined. So if there are more than two family members working, they still need to follow the rules that one of them cannot exceed 40 hours, and together they cannot exceed 20 hours in a week. Having the participant's family provide services does not mean that you will automatically receive the maximum number of hours. Hours are still allotted based on need. So legal guardians are still included in the family role if they are staff. This applies if they are family or not. Please be aware that if you are hired by a company to provide services to your relative, you must follow the family rule. The family rule applies to companion, in-home and community habilitation, life sharing, respite, support employment, support broker, and shift nursing and transportation mal services. For this definition, a relative includes any of the following: a spouse, parent of an adult receiving services, a step-parent of an adult child receiving services, grandparent, brother, sister, half-brother, half-sister, aunt, uncle, niece, nephew, adult child or stepchild of a parent or adult grandparent of a grandparent, grandchild of a grandparent, I apologize, that has a disability. So if you are this relation and providing services to someone in your family, please know that you will need to follow the family rule. So based on what you know, would this be allowed? Example number 1. Mother works providing services for her son 40 hours a week. No other family works with the participant. Does this follow the family rule? That would be yes. Number 2. A mother works providing services for her son 40 hours a week, and brother works providing services for his brother 20 hours a week. This does follow the family rule, as the mother is providing no more than 40, the brother provides no more than 20. So one is providing 40 hours a week, and together they are not going over 60 a week. Example 3. A participant gets 20 hours a week, and two family members split that each week, however they choose. 10 and 10, 20 and 0, 5 and 15. Is that okay? The answer is yes. It is okay with the family rule, as no one is going over the allotted hours. However, please be careful to follow any company policies regarding this. Example 4. A participant receives 70 hours a week. Father provides 40 hours, brother provides 20 hours a week, and sister-in-law provides 10 hours a week. Does this meet the family rule? This one is a little tricky. It does meet the family rule because the family is covering 60 hours combined, and one family member is not exceeding 40. The sister-in-law is not included in the family rule. Example 5. Participant has 60 hours a week approved. One works 20, and two siblings work 20 hours a week each. This does beat the family rule because if mom works 20, sibling 1 works 20, and sibling 2 works 20 hours a week, that is a combine of 60, and not one member is going over 40 hours. Finding a provider that is right for you and for your situation can be very difficult. A provider that fits now may not fit in 3 or 10 years. Evaluate the staff and company at least each year at your IP meeting to see if there are any issues or if they are still able to cover all of the needs. Always tour facilities if you can, such as community participation supports or residential. Ask if you can drop by for visits. What you should ask a provider. When looking for providers, ask the same questions. Things like, how do you ensure staff are on time? What is your policy for staff call-offs? What trainings do your staff receive? How do you evaluate your staff? How much experience must someone have to apply? How much staff turnover do you have? Where is your main office? Who would I contact with issues, and who is their backup? It is an important list to make to ensure that your questions are answered. Since all providers must follow the same regulations, it is really important that the policies they create meet your needs, because each company's policies may vary in how they meet the regulations. Changing or adding providers. Please know that for many of the waiver services, you may have more than one provider. Providers sometimes have a difficult time finding or keeping staff. This is a great option to add another agency so you can benefit from both resources. If you're unhappy with something going on with services, please try to address it with the management of the company first. If you're still unsatisfied, talk to your supports coordinator to discuss other options. Thank you for your time. We hope that this has been most informative. If you have other questions or would require more resources on this topic, please contact us at escaadvocacy@gmail.com.